Hello, good afternoon. My name is Sarah Cuddy. I'm a cardiologist at the Brigham and Women's Hospital in Boston and assistant professor at Harvard Medical School. I'm joined here this afternoon by Professor Marianna Fontana.
Thank you so much, Sarah, for the invitation to be here today.
It was great. We got to be involved this morning in the late breaker session at the opening ceremony of the AHA meeting. And Prof. Fontana presented really fascinating data from nex-z. So, Prof. Fontana, what was the background and kind of stimulus for this study?
So ATTR amyloidosis is emerging as an underdiagnosed cause of heart failure, especially in the elderly. And what we know is that it's a progressive and fatal condition with quality of life and functional capacity continue to decline, increase hospitalization, and ultimately death. Currently, the treatment focuses on either the stabilization of the TTR protein in its native conformation, or they inhibit the misfolding, the production from the liver. However, what we know from recent trials that patients on these drugs continue to decline, with functional capacity and quality of life in declining even though they are on treatment. Plus, these drugs require lifelong administration, and this adds to the overall disease burden for patients. So genome editing is an approach where with a single infusion, you can permanently edit the DNA, and specifically in this disease, what happens is that the CRISPR-Cas9 based technology can bind to the TTR sequence and lead to a specific cleavage in the TTR sequence, permanently knocking down the production of the TTR in the long term. So it would be a complete revolution to treat patients with this agent.
Yeah, amazing technology for patients with ATTR amyloidosis. So what patients were enrolled in this study?
So the study was a phase 1 ongoing single-arm open-label study which enrolled 36 patients with hereditary or wild-type ATTR cardiomyopathy. But the key to the patient population in this study was that it was a patient population with a high proportion of patients with very severe disease. Just to give you some numbers, 50% of the patients had NYHA function class 4. The NT-proBNP was a median of 2,000 but was up to 20,000. The reduction in functional capacity was severe with a peak VO2 on the CPET of 12.7. And there was also a high proportion of variant patients, 2 of which had a V142I homozygous variant, which we know present with an extremely aggressive form of disease. And also, it's important to note that none of the patients received any other disease-modifying treatment.
Yeah, that sounds like kind of the exact population that really would benefit hugely from a therapy like this. So what were the results?
The results was that after a single infusion of nex-z, there was a deep, durable, and consistent reduction in the TTR levels, and the reduction in TTR levels was very rapid. From baseline, there was a percentage reduction to 89% at day 28. And also the absolute reduction was very low just at day 28. But what was important wasn't just it was the deep and very rapid, but was also sustained over time. In the 24 months of follow-up, we could see that actually all the patients maintained their level throughout the duration. So it's how just a single infusion can really treat the disease.
Yeah, that's amazing. And then I suppose what we want to look for are patient outcomes. So I think this, as you mentioned, was a phase 1 study, so we didn't really test for CV outcomes. But what were the other outcomes looked at in this study?
Absolutely. So the reduction, the deep and sustained reduction in TTR levels was associated with remarkable stability or actually improvement in many of the parameters that we assessed. So the secondary endpoints, which included blood biomarkers, functional capacity, and cardiac imaging, were assessed at 12 months because that was a time point that was reached by all patients in this phase, in this ongoing study. And what was remarkable was first the complete stability. We initially assessed the NT-proBNP, the troponin, and the 6-minute walking test that now are established criteria for disease progression that we use in clinical practice. And we know that at 12 months, these would have expected to progress. Instead, in this patient population, we saw remarkable stability and actually functional improvement on the 6-minute walking test in a proportion of the patients. We then assess also the changes in the NYHA class, quality of life, and again, On those parameters, we saw just not remarkable stability in such a severe population of patients, but actually improvement in some of the patients, supporting the concept that if you can reduce very deeply and sustain the new production of amyloid, with some patients you would see actually cardiac amyloid clearance and then improvement. Also, there was stability across a wide range of imaging biomarkers by cardiac MRI and echocardiography, including the cardiac amyloid load.
Yeah, really exciting data, and I think we're going to be really excited about the phase 3 study, but this is genome editing, so I think a lot of people have safety concerns. Was there any kind of off-target safety signals or other safety concerns in this study?
I mean, there was a very good safety and tolerability profile, with infusion-related reaction being the most common adverse-related adverse event treatment-related. And these were mild, self-limiting, and did not lead to any permanent discontinuation of the drug. Also, the elevation in this liver enzyme was only mild and not indicative of liver injury. And actually, when we look at the cardiovascular events, there was a rate of 0.16, which appeared to be patient year, which appeared to be very low for this patient population. So overall, there was an excellent safety signal together with a very good evidence of stability and improvement in some of the patients and very low cardiovascular events.
Yeah, I'm really excited for the phase 3 study. We're a site, you're a site, and hopefully we can kind of accelerate recruitment and get results out fast.
Yes, absolutely, completely agree. Patients are definitely enthusiastic for a single infusion which is going to treat for the rest of their life the disease, and we are enthusiastic as well.
It's been a joy talking to you and hearing about this study in more detail. And yeah, the future is bright.
Thank you so much, Sarah.